All right, everyone. Thank you so much for joining for another episode of Root Cause Solutions for You. My name is Fabiola, and I am your host. Today, I am thrilled and delighted to have Dr. Donald Dennis, who is a medical doctor with more than 38 years of experience in the medical surgical care for disorders of ear, nose, and throat. And he's got an amazing presentation for us. Thank you so much, Dr. Dennis, for being here with us today.
You're welcome.
Well, could you please tell us a little bit about yourself?
Well, I've been ear, nose, and throat doctor for 40 years. So we had a lot of patients that came in with chronic sinusitis, and no matter what we did, nothing would work. So one day, one came back that had never been well in 10 years, and endoscopically, their sinuses were totally clear.
Mm.
So I asked them, well, what have you been doing? Because you've never been clear before. They said, well, we went to the beach for 2 weeks. So then I knew it was environmental. And then we figured out it was mold, and that's how it started. And it's evolved a lot over the years of what you have to do surgically and medically. And then the most important thing is the environmental piece. If you don't get the environmental piece right, none of these patients ever get well long-term, because you're breathing approximately 3,000 gallons of air a day. So no medication or surgery can overcome that volume. So unless you invest yourself in getting the air clean, you can't ever get well long-term, either with sinus or polyps or the mycotoxin illnesses that occur with this disease.
Yeah, that makes sense. I'm super excited about your presentation. And yeah, whenever you're ready, please go ahead and we can get started.
The air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely important, because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and work. You breathe approximately 3,000 gallons of air every day. So no treatment can overcome that volume. The air must be clean in order for you to get well.
That's very powerful.
But that's the main thing. People need to watch out about 10 times. The next one is the CDC had Mold Awareness Month in August of 19. And the way we test the patients to see what their environment is really like, we have mold plate, SDA auger plates, and we tap the clothing all over their clothing, and then we send it off. And this tells us what their environment's really like and what they're fighting. So we want the counts to be 0 to 4 with a tap test. And then we have a simple questionnaire that we have to let everyone complete. And then we pay attention to the way they smell. Sometimes you can smell a moldy odor on clothing. And then we do urine mycotoxins. And if the urine's positive, they're getting mold exposure generally. And if they are, we got to find the source and fix it, or nothing happens in terms of treatments. All the treatment protocols will fail. So one of the sources that here at the bottom, you get sinus5.com or Sinusitis Wellness are 2 of the web pages we use to help our patients get the right treatment. All right, so the 3 key factors are the air you breathe is 5 times more important to your health than all treatment rendered by hospitals, doctors, or medication. And it's 2 times more important than your genetic code, and nearly 60% of all preventable deaths are due to conditions at work and at home. So the environment is really the more important thing.
Yeah.
This is an important slide because mold makes mycotoxins, and mycotoxins are chemicals that are neurotoxic. And this is a list of fungi and the kind of toxins they make.
Mm.
Uh, uh, is important. And we'll go to the next slide. Now, this is more important because if you go in a pathology lab in a hospital and you test all the cancers that have come into the hospital, 87% of them have mycotoxins in the cancer that's known to cause cancer. So
Mm.
it's one of the major causes of malignancy. So that's another reason you want to fix your air. So here's our environmental requirements. You need HEPA air filtration, and you need central dehumidification.
Mm.
The central dehumidification is so that mold will not grow in your coil. So the humidity needs to be between 40 and 50%. And then there's a new thing that's called a bipolar plasma auto clean 1500. Well Air is the company that makes that in the United States. It was actually invented in Israel. So this thing is hooked to your central HVAC fan, and it makes 1,000,000,000,000 ions per second. No ozone and no hydroxyl, so no chemicals. So it removes mold, mycotoxins, MVOCs, viruses, and bacteria from the air, not the contents. So this is a big breakthrough that everyone needs one of those in their central system. And then an air filter, we use April Air 5000. Yeah. And then a Medify can be a plug-in unit in the room. And there's another unit we'll show you later. And you can have no fiberglass in your airstream in your duct system or in your attic that's exposed fiberglass. It has to be sealed. And it can't be anywhere in the coil box.
Interesting.
So those are really important environmental pieces.
Mhm.
So the airborne mold is the soup of mold spores, mycotoxins, MVOCs that enter through the nose and the sinuses and go into brain, lungs, and the entire system. Now, later on in this presentation, you'll see uh, why we know that if you have mycotoxins in your urine, you're going to have them in your brain. And we proved that by artificial intelligence of MRI scans of the brain. So we can see the mycotoxins in the tissues now. That's not published yet, but we're using it clinically. It's very impressive. And we'll show you at the end.
Mm.
Uh, so you have to have clean air, clean water, and a clean diet. The diet for fungus is basically a yeast diet. No refined carbohydrates or alcohol. And your foods are going to be all your meats, your seafoods, all your veggies, and your fruits are going to be veggies. I mean,
Mm.
correction, your fruits are going to be berries only.
Mm.
Uh, that's the basic diet. So you got to get your air clean and your diet clean. Uh, and then no chlorine in the water. So when you go out to restaurants, a lot of times they don't change the filters. And if you get chlorine, it'll overgrow fungus in your gut because it kills everything else but fungus.
Mm.
Chlorine doesn't kill fungus. Chlorine will not kill mold, and if you try to clean it with Clorox, for example, mold will clean well with Clorox, but it doesn't kill it.
Right.
It wipes it off the wall and looks like it kills it, but it's not dead. So, it allows all the competition for mold in your microbiome not to survive. So the mold survives.
Mm.
So it takes over with chlorine.
Yeah, and that's a common mistake. I think most of us, when we see mold growing in our bathroom or something, that's our first thing we use. We use chlorine to clean it up, but we're perhaps creating more damage by doing that.
Yeah, that's right. You can't. It actually makes mold more invasive because you wiped out its competitors, all the bacteria, the smell system. So if the smell goes from your nose to your brain, the that this mycotoxins do the same thing. And you see the pituitary gland up here, and most of these patients get pituitary damage of some of their hormones, especially growth hormone, the thyroid, and cortisol. We'll show you that later.
Mm.
So this is the definition we have of clean air so far, but it's going to get more exact than this. So, yeah, you got to control mold to control chronic sinusitis and neurological symptoms. So the air quality is key. The particle count needs to be less than 50,000 at zero point 0.3 microns. Now, in an air measuring device, 200,000 is considered very good air quality. That will not work for the population that gets chronic sinusitis. It's got to be much better than that.
Yeah.
And then the mold count on a mold plate, a 1 hour gravity plate exposure has to be 0 to 4. And if they have neurological symptoms, it has to be 0 to 2. In general, if you've got really severe neurological symptoms, you should really move and not take anything with you. And be careful to get into a place that you know you're feeling better in. This is for severe patients. A lot of patients can fix their houses, but for example, if they can't walk, they need to get out of there. And we'll see some patients like that.
Yeah.
Uh, these are two units. One is this humidifier. It makes ions. It's okay, but it's not as good as this thing. It's called a Ultimatum 1100, and that makes it'll fill up a room 20 by 40 in 2 minutes with positive negative ions with no ozone, no hydroxyl. So you can sterilize your air in a room with this thing. And this has helped a lot of patients for temporarily until they can either fix their place or get out of it.
Mm.
Now, this is a slide that shows the immune reaction that fungus causes in at least 20% of the population. So this red thing is a antigen processing cell, and the blue thing is a T cell. So the cell wall structure is what the superantigen sits on. But in these patients, they have an immune dysregulation, so that instead of the antigen hooking where this is Ag here, it hooks on the side wall. And because it does that, it activates 30% more T cells. And the normal percentage of T cells to react is 0.01%. So there's 3,000 times more reactivity. And then you've got three types of cells that release interleukin 5, 13, and interferon gamma, the interleukins. And so now you got 3 times 3,000, you got 9,000 times the systemic inflammation per fungal spore. So nobody can withstand that unless they fix their air. So that's a biology and the pathology of the illness. Now this is important because this particular patient, the size X-ray here on the left shows all the sizes of fluid fungus and polyps. So all of this should be black over here because air is black on an X-ray. And so when we clean this out, we have a piece of this that we put on a bowl plate. And then in 4 days, it has a brown halo around the tissue. And that brown halo, when assayed, shows it's all mycotoxins leaching out of the tissue into the substrate. And so that's what happens in the brain. They leach out of the tissue and get into the brain. You see these legs here, all of this is severe dermatitis. And she had 4 dermatologists that couldn't fix this. And this is 6 days after surgery.
Oh my God.
So no dermatologist would ever believe this picture. They would think you were lying because in their world, they really don't treat the underlying immune antigen that's causing the reaction. So they don't remove the mold from the body. They treat this with topical, oral, and sometimes IV steroids. And you will not get this kind of result, and it would take at least 8 weeks to get anywhere near this.
Mm.
This is her hand. You see the difference here?
Yep.
6 days later, it's impressive. This is her face. And she had a heart transplant at age 3 months, and she's 25 now. So the reason she was sick was she was having an immune reaction to the fungus. That's why the fungus stayed in her sinus. Normally, it wouldn't stay in there.
Wow.
So this is another example. This is 2 hours after this photograph. See how red the skin is and how broken out it is?
Hmm.
This is 2 hours after surgery
Wow.
because you remove the antigen that's causing the immune reaction in the skin. So whenever you get to the cause of anything and you remove the cause, you get the outstanding results,
Yeah.
better results than with any medication. Okay, so uh, now this is the picture to show. The picture on the right, it obviously have a mold problem. It's all over the ceiling. Anybody can tell that. But this room next to it on the left has got the same mold count as the one on the right, but you don't see anything.
Right.
So you think it's fine until you put a mold plate out and do the testing. So a lot of the tests that are given, uh, the companies give, there's nothing wrong with the test, but what is wrong with the test is the conclusion of what is normal. So all
Mhm.
these tests have higher numbers than should be the normal level, because normal should be when everyone is well, not when 80% are well. So that's just to show you can't tell by looking at a room if it's contaminated or not.
True.
So this is about the immune system. What happens is this little line here is the mucosa, and this is outside the mucosa. So the mold, the little blue thing up here, will come in and attach to the lining in these patients who are sensitive. And then it elicits the eosinophils to come in, and the eosinophils come in and they release major basic protein.
Mhm.
And that makes a pit in the lining while it kills the fungus. But the pit is this little pit over here collects the mucus, and then it can't get out. So the bacteria start overgrowing, and you can't kill them because you can't get rid of the pit unless you get rid of the fungus.
Mhm.
So, so then this reaction causes a release of interleukin 5, interleukin 13, and interferon gamma, which are interleukins that cause all kinds of inflammation. So if you get rid of the fungus, you get rid of the inflammation.
Right.
So there are about three things that are diagnosis terms, like Marcons is one, and mast cell activation is another one, and then there's one more, but all of those are symptom descriptions, and all of them are caused by the results of a mold infestation. So i- none of those do you get rid of until you get rid of fungus long term. And there are a lot of sprays and things to use. There's nothing wrong with using them, except they won't work long term. As soon as you stop them, the patient's sick again. They-
Right.
You haven't removed the cause. The root cause is the fungus
Yeah.
in all these issues, especially mast cell activation. So that's just a fancy word for allergy. So in all allergy, mast cells are activated because of the antigen. What is the antigen causing it? That's what you have to figure out to fix it permanently. Instead of trying to mask all you know, the, the histamines releasing. Now, there's nothing wrong with antihistamines, but you need to find out why they're being released. What is the antigen causing it? Then you get long-term relief.
Yeah.
Uh,
And I think an antihistamine perhaps is a support that we would use as to minimize symptomology as you're truly working on
that's
the
right.
cause.
Yeah, you need those things. There's nothing wrong with those things, but you can't use it as a cure.
Right.
You want to use it while you're looking for the cure. And the most common was fungus is really called the master antigen because it causes inflammation that causes a number of other allergies. You name it, it causes it. Foods, dust, mold, mildew, grass and trees, all that stuff
Mhm.
uh, is worse if you're in a moldy environment. We've had
Right.
numbers of patients who have gotten rid of all their allergies after they got out of mold. Now, it doesn't happen to everybody, but it happens to a number of people.
Yeah.
Uh, Now, this is the reason I'm showing this one. See all these little red spots are fiberglass causing eosinophil to rupture in this patient's sinus. That's what that picture I showed you before, that's what it looks like in real life.
Mhm.
Uh, so all these patients that have fiberglass in their system never get well because the bowl rise on the fiberglass, and the fiberglass causes release of eosinophils in the lining. See how destructive that is?
Yep.
And now, 80% of the population doesn't react like this, but all of the sinus patients do.
Mhm.
This is a bad one. See this black thing down here?
Yep.
So the black thing is the ulcer has dissolved all the mucosa overlying the bone, and all you can see now is the scab. But now that the bone is present, you can't get any more eosinophils in there, so the reaction stops. So this is all fiberglass.
Wow.
And fiberglass is very commonly inside all heating and air ducts. It's very common, and it's a blown-in insulation in the attic. Now they use foam, but foam causes another problem. The chemicals cause chemical sensitivity, so that takes a long time to off gas. So basically, if you have fiberglass in your air system, you have to get rid of it. It's not elective. Uh, this is a picture. This is a fungus ball in the sphenoid sinus over here to the left. But
Mhm.
this is after an injection the next week. We injected antifungals into the sinus and then came back and re-injured, and it's all gone. Just kept by getting rid of the fungus.
Wow.
Now, this is good. This is good because you can see fiberglass in the air here.
Yep.
That's just the ones you can see. It's millions more you can't even see. So, and this is really common, all the fiberglass in the duct system and in the attic. So all this has to see all the mold growing on this thing. This is a humidifier.
Mhm.
So this is why you don't want exposed fiberglass in your attic or in your system.
Yeah.
The left side over here, the white stuff is candida, and the red over here is after we used amphotericin and candida. So if you use amphotericin uh, and you fix the air, you stop getting the pits in the lining, and you stop getting candida in the nose.
Wow.
So this is just pictures showing the treatment.
Mhm.
Uh, and this is candida here. And after the counts, mold counts down here show lower mold counts,
Mhm.
then the candida is gone for the mucosa up here.
Wow.
Uh, this is a fungus ball inside the sphenoid sinus here. And this is the air quality that they had over here to the right. So you can see why they had all this fungus in the sinuses, because the air was awful. That has to go some penicillin growing.
That's so shocking to see because what you see in the pretty dish is pretty much what's in your sinuses.
That's right. So
Wow.
if it's in your air, it's in your nose, and if it's in your nose, it's in your brain. Not the fungus, but the mycotoxins.
Yeah.
Sometimes it makes its way into the brain too.
Mhm.
Well, this is an example. Right here is a huge amount of aspergillus
Mhm.
inside the that's what size. And this patient was allergic to all the antifungals except for amphotericin. And so she kept having severe lung infections, and she couldn't get better, and her lungs were degenerating, and she was going to die of pneumonia. So we found it in her sinuses, got rid of it, and she fixed her air, and then her lungs totally cleared. So you always want to think about get fungus off the table first.
Yeah.
And after you do that, most of the other things will get better. These are pictures. The red is disorganized thought processes and high voltage. So this person had brain fog. So we get rid of the brain fog by treating her with amphotericin nebulization
Mhm.
through the nose, like this other. You see how all the brain clears up.
Yep.
This is 30 minutes later, which is pretty impressive.
Yeah.
So all we're doing is killing fungus. And of course, you got to get it out of the air first. because you breathe in 2,000 gallons of air. So you're trying to get rid of it with a nebulizer of amphotericin. It's not going to work because you're nebulizing twice a day, but you're breathing 24/7 and you breathe 2,000 gallons of air a day. That's why it doesn't work. Now, this is interesting because I knew it caused brain fog. So this is a audiology test showing the time it takes for the sound to get from the eardrum to the brain.
Mhm.
So this is a QEEG, uh, a brainstem test. So the red and the green line have to cross for the brain to hear the sound. So the top one, the brain never hears the sound, and the bottom one is delayed. So what we did is we did this test on all the patients that uh, before we gave them amphotericin in the nose. Then we gave them amphotericin in the nose, and then their speech recognition to sound was with a normal range after we treated them with amphotericin.
Mhm.
So now this is thought, this is a piece of tissue. This is this piece of tissue over here. This is
Uh-huh.
what first started all of this. So the tissue has got a brown halo around it. So if you take the brown halo and take the tissue, uh, and then assay it for mycotoxins, they're positive for the same mycotoxins.
Wow.
Same ones are also in the brain, and we can show you that later. So when you see the brown halo, you know that's mycotoxins in a SDA agar plate. And you see this is fungus up here, and you see what it looks like surgically, like where you take it from.
Yeah.
Uh, so this is the one that does not have fungus in it, has no brown halo. So we assay that tissue and it doesn't have any uh, trichothecenes. But then you assay this, and it's got trichothecenes in it.
Mhm.
So if we assay both the agar that's brown and the tissue, you get the same thing.
Yeah. Wow. And it's almost like the sinuses are the perfect environment for mold grow and bacteria and all that stuff because it's moist, right? It's warm.
That's right. And you see, this is the actual mucosa taken out of the sinus.
Mhm.
So you're seeing that the mucosa is feeding the brain more mycotoxins 24/7. So it has its own manufacturing facility.
Yeah.
So that's why you have to fix the air. If you don't fix the air, nothing ever happens.
Makes sense.
This is before and after picture of the face of a patient after surgery. You can see how much better she looks. This is like the next day after surgery.
Wow. Yeah, I mean, you can see like her skin color.
It's a
Uh
totally different patient,
yeah,
right?
yeah, and her eyes. That's amazing.
Now, surgery is not the answer if what? You don't fix your air.
Mhm.
You got to fix your air. All right, this is a guy. This guy had hearing loss for 10 years. Uh, and then when he woke up from surgery, his hearing was restored. Now, I would bet you a large amount of money that's impossible until it happened, you know. So the chances of getting hearing back after 10 years are pretty remote, but he did get his hearing back. And so you see what we pull out of the sinuses, this piece of tissue here, it's
Mhm.
got the brown halo around. So as soon as we removed the mycotoxin, he was able to excrete the toxin rapidly uh, after we got out of his nose.
Yeah.
So he didn't have the gene that, you know, is the slow MTHFR, so they can't methylate B12. He didn't have that. As soon as we got it out of his sinuses, his hearing came back.
Wow.
Most of the time that wouldn't have happened. Yeah, you just gotta get it. Just know this: give a urine mycotoxin. If it's in their urine and it came in through the nose, where is it? It's everywhere,
Yeah.
including their brain. And so then you start as something that you can deal with. Then you need to start doing mold placement, discover where is the contamination coming from and fix it.
Yep.
There's no way around it. You either got to leave or fix it, you know?
Yep.
And about half the people will do that. The other half won't. And virtually no treatment works. because it's so much volume. This a patient that didn't want her picture shown. She was exposed to mold, had high mold toxicity, and then we operated on her and got these polyps out of her sinus and put them on the place, and then they grew out. That they were positive aflatoxin and mycotoxin A. All right, so after we did this, 6 days later, she comes back. She was hospitalized in Canada for severe suicidal depression. And she had 3 little kids. And so they shocked her brain 18 times. They gave her every drug that you can think of for depression. Every drug was tried on her and nothing worked. And so she was basically released. And I don't remember how she found me, but she came down here and she said she was going to kill herself. So I said, well, before you do that, let's try something. And so we operated on her. And about 6 days later, she came back and all of her depression and anxiety was gone.
Wow.
Just by getting it out of her nose to stop the contamination from her brain. So then she was able to excrete it. And then she hadn't been depressed since. But how many people with severe depression are mold patients?
Yeah. Oh gosh, yeah, it's such a common symptom, and yeah, and then we take a medication, and it just makes things worse, right? It doesn't fix it, and it's just the nature of mold, right? It wants to compost you. What is its job? Is to kill things, right? To take over.
That's right. And so the good thing about her, she was able to excrete it. So she didn't have the slow gene about excreting it. Otherwise, it would have taken months to get rid of that.
Mhm.
But this is a few days later. So she's back having a normal life now.
That's
So
all.
this is the same kind of situation.
Mhm.
These are this to show you. See, now we don't have to test the agar anymore. We know if we see a brown halo, it's some mycotoxin. So that's
Mhm.
how we do it surgically now. Well, pre-op, we've got the urine, we know it's positive, but this actually helps the patient know that that was what's causing the problem because they can see it now.
Yeah.
Uh, and now this is an important slide. Almost all these patients have pituitary damage. Why? Because it's right below the sphenoid sinus. The fungus and mycotoxins get into the sphenoid sinus and they go directly to the brain. So think of it like this. People used to sniff glue and get high.
Yeah.
Okay. You take the glue away, the high goes away. So that's an example of a chemical that goes directly from the nose into the brain. The high, it means it's in the brain. So these chemicals act like that and they cause brain dysfunction. And they go into the pituitary, and I'll show you later a picture of this. And we actually can see the mycotoxins in the pituitary with artificial intelligence now. Isn't that amazing?
Yeah. It is.
And so this patient had mycotoxins in the pituitary. And so the common ones are growth hormone, 51%, thyroid, 81%, ACTA, 75%, and ones that had the combination, 44%. So everybody gets all their hormones drawn, and we sent to a really good endocrinologist. We use David Robertson, and he equalizes all the hormones that are missing. Now, just so you know, all the practitioners that might be watching this, when you do an IGF-1, that represents growth hormone. All of these patients, underline all 5 times, had normal levels, resting levels of IGF-1. So no one would have ever worked them up.
Yeah.
So if you challenge them to make them make growth hormone, they could not make it.
Mhm.
So then they have to have injectable because you can't stimulate pituitary to make it because they can't make it. So if you don't do that, they can't make new cells. So instead of calling it growth hormone, it should be called cell replacement hormone.
Yeah.
That would be a proper name for it. So these patients can't make these cells, so they can never really get well long term with it if you don't fix that. So all of them that are qualified need to be tested to see stimulated to say, can you make growth hormone yourself? Yes or no?
Right.
And so a lot of times part of the pituitary is damaged and they can't make it. So you just have to take the hormone either orally or
Mhm.
injectable. You simply take the ones you're missing and you're back to normal.
Yeah.
So that's how you have to treat them. If you don't give them what they can't make, they can't ever get better.
Yeah, and I think of the thyroid, yes, it's thyroid medication, but it's really a hormone.
That's right.
And how many people are taking a thyroid hormone medication and they feel the same or worse?
A lot of them,
Yeah.
because you haven't got out of the mold.
Yeah. Makes sense.
So when you have the patients come in your office, just get the SDA article place, tap their clothes. You get it back in a week or two, and then you'll know if they have a problem or not. It's yes or it's binary, yes or no, and then you have to address it. Uh, get mold is really one of the easier things that cause chronic illness to address because most of the time you can fix the environment, and if you can't, you got to move, but you can't take all your stuff with you. So this is a result of so this is a published study. I did one. The average was 123.
Mm.
Now that's normal range, you know, normal, and the number of patients was 79. So the range was 43 to 285. The
Mm.
normal was 88 to 249. So who would have worked up most of these patients? Nobody.
Yeah.
Because look, Miss Jones, your IGF-1's normal. You're good. And they weren't good. See, so you got to do some other testing. And then 51% were growth hormone deficient and would have virtually died early and had accelerated aging
Yeah.
just because of no growth hormone.
Yeah.
So surgery is helpful in terms of removing it from the sinuses so it doesn't get in the brain anymore.
Mhm.
But more importantly is removing it from your hair. If you don't do that, surgery is totally ineffective because you replace it all in 24 hours that everything was taken out. Put it right back.
Yeah.
Uh, now, this is interesting. Okay, this guy has tremors. His left arm is shaking, and then we treat him after surgery, and he left his house, and now he doesn't shake anymore over here.
Well, and even his face is different. Like, all that puffiness, inflammation, it's gone.
Yeah, you can see it's different.
Yeah. So
Now, this guy is in a wheelchair for 2 years. He can't stand up by himself. He goes to Bill Ray and gets a lot of treatment. He needed surgery, got surgery cleaned out, but he did everything to his house you can think of. No good.
Yeah.
So he leaves his house, goes to the beach, and in this video, he's walking normally and telling you about his life.
Wow, that's amazing. So fibromyalgia. Here this slide is talking about fibromyalgia. How many people are diagnosed with fibromyalgia? Then it's truly a mold toxicity. I feel like fibromyalgia is like we don't know what's wrong with you. You're in pain. This is your diagnosis.
That's right. So this patient can't stand up. She's in a wheelchair. She's got a tumor on her spine, and
Mhm.
she's got urinary incontinence. She can't urinate. She has to have a catheter.
Mhm.
She got blindness in her right eye. She can't move her right eye toward her nose. And this second picture is the eyes moving normally. She's standing up, walking around. The catheter is gone because she moved. She was in a moldy trailer. She moved out, didn't take anything with her. And then we did antifungals and detox. And she comes back. She's at about 4 to 6 weeks later, and she's totally normal.
Wow. Wow.
Yeah, and the vision's getting better.
That's awesome.
So that's what that shows. Now this guy's dragging his feet. He can't walk. He's dragging both legs. This is totally normal here. And this is was sick again because when he got to the airport, he got a moldy car and he come to my office in 30 minutes in the car. He almost can't walk again. This to
Mhm.
show you how fast you can get from well to sick once you get back in it.
Yeah.
So,
Yeah.
and this one had paralyzed vocal cords from there in the dental office and
Mhm.
in her apartment, and she got out of there, and then her vocal cords are not paralyzed anymore. She's got a normal voice.
Oh my gosh.
All right, so now this is all artificial intelligence. So
Mhm.
what we did is took the vials of urine. So these patients have a positive urine mycotoxins. Whatever one's in their urine, we image that urine from the lab, a known mycotoxin, and we MRI scan it and CT scan it.
Mhm.
Then we run our algorithms until we can see something in that known vial of gliotoxin. And it turns out it's a black substance. And
Mhm.
then we run the same algorithm on the CT scan, and we can see there's black spots here. You can see the black spots in the sinuses, and this is the mycotoxins coming out of the tissue. So
Wow.
that's the first time in history you can see mycotoxins in the sinuses. So uh, we'll go to one more. Now, this is the most important one. See, this is the vial down below with the black stuff in it. That's gliotoxin because
Mhm.
this toxin was in the urine of this patient. That black thing is a normal MRI scan, but it shows she's got a big tumor in the pituitary. She had a 100-pound weight gain uh, and diabetes from this tumor secreting cortisol.
Yeah.
So send it to the endocrinologist, and then neurosurgeon operates on her and take the tumor out because otherwise she's going to die because it's going to make her have like 500 pounds till she finally dies, you know.
Mhm.
So he takes the tumor out through her nose. We get a piece of the tumor. We assay it for mycotoxins. So guess how many mycotoxins are in the tumor in her pituitary gland, in the brain? 11.
Oh my gosh.
11. So when you see one, you're seeing 11 or more in the brain.
Wow.
You're breathing the super stuff in the environment. It's not sterilized and breathing one at a time. You're breathing a large soup. So all this black stuff in her brain is 11 mycotoxins.
Wow. And mycotoxins are competitive for space.
Yeah. And so it destroyed a pituitary to start with. It's destroyed her brain.
Yeah.
Now her brain's normal. She moved out, got everything fixed. So, so this guy had a colloid cyst in the left ventricle of his brain causing severe deadly migraines. So we took it was gliotoxin in his urine. So we did gliotoxin was blue with red spots. And look what it shows. It's blue with red spots. So that's gliotoxin. So what happened is his body put a cyst around that to protect his brain from the gliotoxin. Is that amazing?
It is. It's like the body's self. I mean, the body's so intelligent. It knows what to do.
Yeah. And then this is another one. See these little white spots over here?
Yeah.
These are common in MRIs in mole patients because they're the smallest vessels at the junction of the gray and white matter, and that's where the capillary gets clogged and they get problem.
Mhm.
So this is what she really has. See all this stuff here?
Mhm.
This is
Yeah.
what she really has. And so we got all that out of her brain, and now she's much better. She's a nurse, but that's how good MRI is. MRI, if you run this algorithm on that data, you can see all the mycotoxins. That's all we're doing.
Wow.
And so this is no, see all these black stuff,
Yep.
all this white stuff is uh, polyps from mycotoxin exposure. And
Mhm.
the two of these image black, gliotoxin and trichothecenes. So see how much stuff is in those?
Yep.
Uh, Now this is another one. All right. So he's got this huge amount of gliotoxin in his brain. So they
Hmm.
wrote this is a super of 11 or more. And he didn't want surgery, but he needed it. So this is a year later. See, we got it out of there with oxygen, glutathione, NAC, and liver cleanse, and Intramax, which is a liquid vitamin. The oxygen is the key. You
Yeah.
can't get it out of the brain without oxygen. Uh, so now this is a little bit fringy here. I'm guessing what this is. We can never been able to image VOCs. I think this is the first time we ever imaged VOCs.
Hmm.
Right? Uh, see these little black spots?
Yeah.
That that is air. So these organisms are making air, just like humans do when they metabolize food.
Hmm.
Right? So look over here on the right side. This is the same algorithm as it took to see something. This liquid is where the gliotoxin is. But see, there's something in the air above that. You see that?
Yeah.
All right. So look, the air is not black in here. It's got white spots.
Yeah.
They're those white spots here. So this, I think, is VOCs in that. It's making VOCs and not
Yeah.
methane gas. You see what I mean?
Yes. That's wow. Yeah. It's like a whole world inside our bodies creating waste
Yep.
products and everything else.
So we've only done 100 of these so far. I'm going to write an article and then we'll get it in mainstream, but it's going to take a while.
Yeah.
When you see it in your brain, you can't keep tap dancing and ignoring it.
True.
All right. So this is the patients need to copy this and read it 100 times. This is your work list for why I'm not getting better. So everybody needs to just write this down. 90% of the time, you're still in it. Even when you're sure you're not, you're still in it. Okay, so you got to do plate counts and tap testing, test your washer, dryer, your cars, and your pets, and all that stuff. Can't sleep with pets. And then when you find it, do something about it.
Mm.
Even if it's your dog, it doesn't mean you can't have a dog, but he can't be in the bed with you.
Hmm.
You know. So then number two is diet. So you got to get your diet right, or if the sugar makes you have hyphal formation
Yep.
in the fungus, in invasive hyperform, and the invasive hyperform is resistant to all antifungals. So people think they're getting resistance to the drugs, and all they're doing is eating sugar.
Yes.
The organism is resistant because of the sugar, not because of the drug.
Yeah.
All right. So in the pituitary, you got to check the pituitary, and then treat for all these other things: lives, Epstein-Barr, heavy metals, MTHR. Do all that treatment, and occasionally it's cancer, but that's rare. That's
Yeah.
single-digit percentage. But this is the work list. If I had why you're not better. So here's the summary: clean the air, chlorine-free water, uh, uh, get mold off the table first by tap testing.
Yeah.
Highest concentrations in the sinuses and in the brain, in the urine. So evaluate the pituitary, make sure it's okay, and replace whatever's missing,
Hmm.
and then and know what you get it out of the air with plugging. EC3 plugging is another thing we have.
Yeah.
Uh, and then citral drops. You can put them in your nose, Ross. You can drink them, and you can nebulize them,
Yeah.
and then fix your gut, the liver, and the immune system. This is all the to-do list for the treatment.
Yeah. No, that's us. I've been using the EC3 laundry for about 6 months now. I can definitely tell there's a huge difference.
All right, so this is mycotoxins. This is just what you're doing. This is a treatment protocol we use. You got to rinse your nose out, and you got to irrigate them. The best one is the lavage. If you get that, do that. And then if the citrus drops in there, or put amphotericin or voriconazole in there.
Mm.
You got to use oxygen. Uh, 2 hours a day or titrate whatever you can tolerate. And then we use glutathione, NAC, liver cleanse, and intramaxillary optic cleanse. Uh, Either one of these works.
Hmm.
And then this is what we do. And I like Intramax because it's 413 items, so you can't miss anything. And it's bound to carbon, and you get the one that's sugar free. And most people can tolerate that. And it's got everything. So having 50 bottles, you don't have to have that much stuff.
Yeah.
Uh, and that's this is the fan that we just talked about, and this is environmental treatment stuff.
Yeah.
It's EC3 is the stuff that we use, and candles to get it out of there. This is all environmental stuff.
Yep.
But she's gonna give you a link to the page, and you got the link for them.
Yep. We got it all.
The link, so you go on, just it walks you through what to do.
Yeah.
You get to the web page, and it's easy to do.
Yes.
And this sinus defense got transfer factor in it to all this stuff. It took 20 years to do this, but this is transfer factor. All of these antibodies are in there. So you can imagine that.
Yeah. Yeah. I use that every day before I go to bed and as soon as I wake up.
You amp it up with the Betamax, this beta glucan. It makes it 300% more active because it actually make more white cells. So you just take one of those twice a day for that.
Awesome.
And then this is the conclusion. Okay, this is all your wash out stuff. All right. And this is all your other stuff. You'll get a link to the web page and it'll show you how to do all this.
Yep. Yeah. We'll make sure to include everything.
We don't have to waste time on this. But that's the end.
This was super impressive. I mean, I think most of us walk around or have walked around unknowingly being mold toxic. We don't know why we're sick. We don't know why we're not getting better. We've tried so many things. And I think once we go down rabbit hole and really get to understand how mold is affecting every system of the body and are
Yeah.
willing to put in the work, right? Diet, environment, everything, that we start getting better.
Right.
Yeah. I
So
wanted to ask you something about ozone. I mean, there's, obviously some practitioners are pro ozone when addressing mold, some others are not. What's your opinion about it?
you mean in the body?
Yeah, using it as an air purifier or
Okay, you don't want to use ozone for the air
Mhm.
because it knocks off the cilia in the nose. Now, if you want to ozonate something and be out of there, wait till the ozone's gone. That's okay, but it works for at least 5 minutes.
Yeah.
It's kind of useless long term.
Mhm.
You're lucky if it works the whole day if you got a moldy place. So that's not the way to really get winter. Well, you got to find out what's the cause of humidity, where did it get wet, remove it all, remove the cause, and then you got to treat everything. And some of the stuff you got to throw away.
Yeah.
But we got remediators that know how to do it properly, and most don't, unfortunately. They're not human health trained. They're mold trained, but that doesn't help you much. They got to be human health trained to do the correct job. So they don't put stuff in your house that makes you sick.
True. Yeah. Yeah.
Uh,
That's true.
So the whole remediation thing and the environmental piece is a whole nother talk. But basically, you've got to get rid of the cause and you got to remove everything that got contaminated.
Yeah.
You got to be very aggressive at it. And if you're really sick, the best thing to do is get out of it. Don't take all your stuff with you. Get in a place where you know you're getting better and address it from afar.
Yeah.
And if you can't fix it, then you got to move and sell it. But with disclosure, of course, that it's contaminated.
Yeah. Yeah. No, that's for sure. I mean, sometimes I, look in at different housing apps, like houses for sale, and they show you all this. Sometimes you can see some of the mold damage. And I'm like, don't buy that house. It's contaminated with mold. So you have to know your stuff for sure.
Yeah, and then some patients can't tell for 3 or 4 days that they're in a bad place and they're at a disadvantage. So they got to use mold plates right away and then sort of leave until they get the growth back. Because uh, you got to know for sure before you move. Moving is not magic unless you get it right. It can be very expensive if you keep getting it wrong.
Yeah, for
You got to
sure.
be really thoughtful how you do it.
Yeah, yeah. And I mean, as a practitioner, I'm always asked a question that is so hard to have an answer for. How long before I get better? Um, so I'm sure you get that same question. And in your opinion, how long can someone who's really ill and battling with mold for a long time? I mean, it could take months, right? I mean, if not
Or it
years.
could take months or years, but if they usually, once they're out of it and they're on the right diet, within a few days, they feel better.
Yeah.
They know they feel better. And then once you get to that point, the rest is easy. It
Yeah.
gets faster and faster as you do the oxygen glutathione. But some of them need surgery because they have so much uh, fungus balls in their sinuses that they're making more internally than externally.
Yeah. Yeah.
So, and sometimes I think about the people who have it in their sinuses. Probably half of them need surgery, half of them don't. But the way you know is you start treating them, and if their energy score is a 9 or 10 out of 10 and, uh, and the cognition's the same, they don't need surgery, because what you can't make them better than that.
Yeah.
So, but some of them have negative CT scans that still need surgery because you can't see mycotoxins on a CT scan.
Yeah. Yeah. Someone with like severe sleep, disrupted like
She That's usually mycotoxins, and it usually is knocking out the pituitary and then growth hormones down, and that just growth hormone makes you not be able to sleep. So does when you're in mold, you have anxiety, depression, and you can't sleep
mm,
because your body's wanting to run. It's just not wanting you let you go to sleep in that environment is what it's trying to do.
yeah, it's true. Yeah, gosh, that's so true. Yeah, oh my gosh. So if I mean, Dr. Dennis, you are a miracle worker. You're helping so many people with your years of clinical experience and the support that you use with your patients through supplementation and everything else. And if someone were to be like, I totally want to be working with Dr. Dennis, where is your practice?
Oh, it's in Atlanta, which you just the easiest way is just to say sinus5.com
Mm.
and
Perfect.
it'll take you there.
Yeah, I will make sure to add your contact information because I'm sure there's going to be so many light bulbs going off as people are listening to this and watching this presentation. And we want to make sure that they can reach out to your practice and,
If you just look up Dr. Donald Dennis, Atlanta, Georgia, you'll find me.
perfect. Perfect. Awesome. Well, I really want to thank you for spending your time with us today and educating us on a very important topic. Was there anything else you wanted to go over before we end off?
No, that's it. That's it. Thank
Aw-
you very much. It's a pleasure being there.
Awesome. Well, awesome. So thank you so much.